Are you getting ready to turn 65 and you don't know anything about Medicare? There are so many ins and outs, so many different options with Medicare, but I think first of all, the most important thing is when do you enroll for Medicare? So you have a 7-month window to first initially enroll in Medicare. You have the first 3 months before your birth month, you have your birth month, and then you have the 3 months after your birth month. So let's say, for instance, your birthday is in April. You can sign up in February, and those benefits will start on April the 1st. If you sign up, let's say after your birthday, let's say you sign up in June, then those benefits will start the following month on the first day. So that would be July the 1st. So that's the first thing about Medicare that I think is important to know. When do you sign up? Another thing that's important to understand is what are all the parts to Medicare. So there's Part A, that is the hospital care. There's Part B, which is medical, that's your doctors, those things are included. Part C is actually a Medicare Advantage plan, and that's separate from original Medicare. We'll talk about that in a minute. And then there's Part D, which is prescription drug plans. One thing you want to know about Part D that's very important. If you do not have a prescription drug plan through work, which is a creditable, it would have to be a creditable prescription drug plan. So in other words, it has to be just as good as Part D. You want to make sure that you have that. This is why it's important to sit down with a Medicare professional, with an agent or broker that knows all the ins and outs of Medicare, because they can make sure that you have exactly what you need. The next decision you have to make is, do you want original Medicare Parts A and B? Or do you want a Medicare supplement? Or do you want Medicare Advantage? So if you have Parts A and B, obviously you're going to have Part D. That's that prescription drug plan that I mentioned. Another option you have is to have original Medicare, Parts A and B, and also get a Medicare supplement. A Medicare supplement is also called a Medigap policy. That's going to cover the gaps that original Medicare may not cover. There are also prescription drug plans along with that. If you decide to get a Medigap policy, you're going to pay monthly whether you use it or not. There is another option that's Medicare Advantage. That's Medicare Part C. Medicare Advantage plans, or Part C, is provided by individual private insurance companies that have to provide the same coverage as Parts A and Parts B, and some of them have other benefits as well, such as prescription drug plans, dental, vision, and hearing. So they are an all-encompassing product. I have a lot of clients who are on Medicare Part C and love their Medicare Advantage plans. I also have clients who are on Medigap policies. It's an individual choice, and it's also depending on what you need. A lot of Medicare Advantage plans have $0 monthly premium. Some of them have high deductibles, some of them have lower deductibles, some of them don't have a deductible at all. So these are all factors that you want to sit down, you want to look at these. You may ask, do you have to pay for your Medicare? Medicare, original Medicare Part B, everyone pays for that. However, there are some Medicare Advantage plans that have a give back or rebate that pays you back part of that money or maybe close to all of that money. So it just depends on the plan that you get. Another important factor when you're considering a Medicare plan is, are your doctors on the plan? Do you have doctors that you visit regularly? Are your prescription drugs on the plan? Is your pharmacy on the plan? All of these things factor into these choices. As you can see, choosing a Medicare option is complex. So you want to make sure that you get an agent who's going to educate you, someone who's going to listen to you, listen to what your needs are, and make sure that they give you just exactly what you need and they provide every option available to you. I hope this has been helpful for you. I want to thank you for joining me today. I'll see you next time. Thanks for watching.